So today we are having one of our expert professional who is going to take us through the caregiving, one of the basic part of caregiving, that is the bed making. Request him to tell us what is bed making, what are other types of bed making, and also why should we do bed making, especially in hospital setup or in caregiving setup. So I'll let him introduce himself and take us through what is bed making before we start making the bed.
Omondi Alvin. I teach caregiving, and so she's asked a lot of questions. I believe I'll be able to at least tackle a few of them, if the best that I can remember. So, bed making is not just a normal routine, or maybe just coming to change the beds, the bed sheets, and then moving the patient and all that. No, it's a routine caregiving procedure that ensures that our patients are granted the most desired comfort. Remember, this patient needs comfort so that they're also able to heal as quick as possible. And therefore, if we don't make these beds, we'll be running away with their hygiene, their comfort, and of course, this will be detrimental to their recovery process. Well, you asked me as well the types of beds that we really have to make. And I did, allow me mention a few. Most important is to understand that we have the open bed, then we also have the closed bed, and then we also have the occupied bed. So I'll maybe start with the closed bed, because out of the closed bed I can now make an open bed. Assume that this patient was not here. Then I'll be starting by making a closed bed. So closed bed waits for, it's prepared, waiting for any future eventualities. A patient comes, we need to admit them, so we'll have the closed bed made accessible for the patient. Then we also have open bed. You'll also realize that there's a difference when it comes to now having this top sheet and of course the blanket. The top sheet is generally, it gives comfort and then ensures that the person lying here is really comfortable. Then the blanket now provides the warmth, because these people, understand when we'll be talking about the vital signs in another schedule, you'll understand that we'll be talking about the temperatures. So people who are sick naturally, they have temperature fluctuations, the fevers and all that. So I've talked about the top sheet and of course the blanket itself, it gives the warmth. Now, you'll realize that if I was to make an open bed, then this top sheet and the blanket, I would have them folded so that it makes the bed easily accessible when we want to have a patient lying on it. But for the closed bed, you'll have these ones generally spread and put so much ready even with the pillows. So the angle of spreading and of course the folding of the top sheets and the blanket will be different. Now, if I'm to make an occupied bed, it means that I'll be making an occupied bed with the patient lying on it. So that means that I'll be rolling the patient systematically when I also ensure that I take care of what is called the body mechanic, the natural alignment of the body. Probably this person has a problem with their spine, and so when I roll them carelessly, I'll be causing more injury than good, and so I'll be taking care of that. So in also another thing I need to mention before I get to proceed is that when we make an occupied bed, we need to take care of the patient, that their privacy has to be taken care of, because we're making the bed with the patient lying on it. So in this case, I may not do it alone. I'll need another person to come and help me. Generally, the bed is made to ensure that there is comfort, there is also hygiene taken care of. Remember, this person could be releasing fluids. And so I'll also be coming to talk about something called the decubitus ulcers, or the pressure ulcers, or the bed sores. Let's do it practically.
Okay.
Now, in this case, the patient is already lying here.
Yeah.
That means we'll be making an occupied bed.
An occupied
Right?
bed. Okay.
So let's start with that one. Now, when we make this bed, we'll ensure that this soiled linen, the soiled linen is the dirty beddings that already the patient is lying on. We need to change them. So as we change, we'll need to substitute them with a clean linen. One thing that we must also take care of is the precautionary measure of ensuring that there is no contamination here. So as you touch the patient's surrounding, your hands have to really be clean. But in this case, we are wearing the gloves. Now, these gloves are not just for touching the patient to protect yourself from any infection or contaminate or getting infection from the patient, because the patient can also be a source of infection. Don't just be touching the patient with these gloves unless you've also realized that this patient is not going to react through allergies elicited by these gloves, because there are some people who are allergic to latex. So if this is not a latex-free glove, then you must not be touching the patient carelessly unless you've established that they're not going to react. But let's then proceed to that. Now, assume I don't have a curtain here, but what I would do, the ideal way was that I would have this environment enclosed so that my patient is always taken care of their privacy. Now, we'll have to roll this, we'll have that. So we'll have to fold this back so well. Necessarily, we just need to fold it back well. Fold it back well. Now, these are soiled linen that we are removing. And so assume that I have a curtain enclosing this environment so our patient's privacy is taken care of. Now, another thing that you must do, you'll have to put these ones once we fold it like this. These are soiled linen. We are not supposed to be putting soiled linen on the floor. So if I have a basin or the right place to put this linen, I will place it there so that it waits for cleaning. Now, this is the blanket, right? This is the blanket. Fine. So let me say this is my dirty area, right? This is my dirty area. Now I'll leave it here. This is for demonstration. But if it's the ideal setup, you can never place it there. Well, now this is what? The top sheet. We now remove the top sheet. We now remove the top sheet. Carefully. We'll have to remove this one really carefully. Carefully. These are soiled linen. I'll place it here. Now, I will have to also remove this bottom sheet, right? Yes. Then there can also be a guard. For instance, look at this mattress. It's giving this patient comfort. But then it is also enclosed in this waterproof material so that we don't have the mattress becoming damp, right? Probably this person has urinary incontinence and then you have not placed a catheter on them. So they can always have the problem controlling the urine flow. So if we have this mattress guard, it will ensure that our mattress doesn't become wet. So we'll have to remove this one gently. Well, now this patient will have to do what? Move them, right? So that you're also able to remove the pillows. So we have to work, the two of us. I just have to lift him carefully and then you remove the pillow. So we'll remove the pillowcase, we change it, and then have the one that is now clean, that is not soiled, right? Then we'll have them to remove this bottom sheet carefully. That is why we have to work, the two of us. Well, what we will do, I'll have to move the patient as you proceed with that other course, right? I'll move the patient. We'll remove the entire of this, right? So we are making a closed bed with the patient right lying on it. So I just want you to proceed. It's good. That is good. So I'll help you. We are going to replace with a clean linen. That is going to give our patient a lot of comfort.
Well, the patient is still lying there.
The patient is still lying on the bed. So as we make one end of the bed, we'll have to roll or turn our patient to occupy the already made position. Actually, the ideal way, what we should have done, instead of putting them to lie here straight, we should have removed the soiled linen as we replace with a clean one. So we're going to spread this. I believe our learners are able to see what we are doing here. Well, so what will we do? Now I want you to first help me make this other side. The bottom sheet is thoroughly tucked under the mattress because we don't want to have a crumbly bed. You see, a crumbly bed will be aiding friction. It will be a source of friction, right? A source of friction. And then it will bring a lot of discomfort. And that is a source of the pressure ulcers, what we call the decubitus ulcers. We need to ensure that there is comfort in this bed. You're going to proceed with that as I have the patient lifted. So you have made that other end. You proceed systematically with that other end. Maybe you can have the patient. No. Okay. Let me roll the patient for you. The side, just have them. Yeah.
So it's a two-people job generally.
Of course, you can't be it alone. You can't be it alone.
Then I tuck this.
So this top sheet, the bottom sheet has to be thoroughly tucked. We don't need to have a crumbly bed. Remember I told you that could be a reason for the pressure ulcers. When the skin is damaged, and of course the tissues, the inner tissues, because of probably shear or let me just say friction, and so you have that area of the skin destroyed because there is no good flow. There is no good flow also of blood, and that place becomes deprived of enough oxygen. The skin becomes cut, and then we have pressure ulcers. That one can find patients that lie here for the longest time because they're not able to move, or when they lie on one side for so long, or even patients that are probably on a wheelchair like that one, they're likely to have the pressure sores of the bed sores or the pressure ulcers or the cubitus ulcers. And so areas that are likely to have the pressure ulcers are around the elbow, the heels, and of course the back of the hands, the hips, the buttocks, and a lot of places. Now we have this patient occupying this bed that is now clean. Remember, that has to be returned so that we support the neck and the head. So that has to be returned. Assume that you've changed the linen. Good. So just have it. The bed, if I was to make this, remember there's what we call the body mechanics, the natural alignment. So if I'm to make this bed and then the bed is too low for me, I love to raise it at a height that is comfortable for me. Okay? Then I make this bed, then I'll now return it to the level that is comfortable for the patient. This bed has areas like we have this device here. We are able to move it to the height that is convenient for our patient so that they don't feel so much rest. And even when I'm operating on this bed, I don't have to really bend so much. So I'll make it at a height comfortable for me. Then I return it to the height comfortable for our patient. So I have the top sheet applied. Just have it from the other end. So you don't need to be casual. Yeah, you don't need to be casual. You don't need to be very casual. So what do you do? This top sheet will come here when it's already folded, right?
Yeah.
So that I just have it placed at the foot of the patient, and then I roll it over. It comes to the convenient region here of the chest region. Then I'll have it also resting beside the rails, and then I have the blanket applied on top. And then with that, you'll be done with making the occupied bed. Okay?
Yeah.
So let's say that this one was folded properly.
Yeah.
Then I'll come, place it, and then I roll it over to have our patient covered. Okay? And then with that, you've made an occupied bed. Okay. Maybe for demonstration, we need to see. They're not lying on the top sheet. So there'll be no question in the friction or any discomfort. So that is not really a problem.
Yeah.
So you'll have it really brought so well. And then
We have to fold this here.
okay. So you'll have to do that. And then now we'll need to apply the blanket on for warmth. And then the patient can proceed and can keep lying here as we wish them quick recovery. So assume that this bed had no patient. Ideally, we'd begin by making a closed bed. I had started by talking about that.
Yeah.
We begin, the procedures are the same.
I saw in the practicals, they were wiping with something. What is that?
Yeah, they were cleaning, or they were using a decontaminant that is not probably not going to cause discomfort to the patient. So they were just doing the random cleaning of this bed. Yeah. If I came and found that the bed is not clean, I would definitely wipe it. Yeah. I'll definitely wipe it. Okay. Or if there was any fluid that I suspect can be posing any risk, I would definitely just do the random cleaning so that this area is really hygienic for our patient and also the people that come to handle the patient. Remember, there can be also the POCT, the point of care testings, and then things happen in this region. So hygiene is really important.
Macintosh, ice.
Oh, yeah, if such a case, not all of them, but then, like, let me say this one. If you see the other bed, well, a catheter was removed. In case I talked about something here, you find that people have problems controlling these wastes. So to ensure that we don't make this mattress damp, and of course, because we'll remove these linens, but then what happens with the mattress? We'll have to protect it.
Yes.
We'll have to protect it. So if this is a patient that is probably having a catheter placed on them, it will also help us to control urine from coming directly into contact with that mattress. But then we also have here the Macintosh. Handling human beings comes naturally. Comes naturally. It comes naturally.
How many times should we make a bed? Like, for example, you have a closed bed, there's no patient. So every day or twice a day, or how many
You have a closed bed, there's no patient. Definitely, I'll have it covered. But then in the event I think there's already dirt on it, I'll come and change the linen. So it waits there, covered, waiting for patient. But then the moment we now allow it accessible for a patient that comes in, then now it becomes an open bed. So many types of beds. We also have like the surgical bed. Someone is from a theater, then you'll have them back to the bed. The operative bed, I think that one is done. Our colleagues for the perioperative, they have such like beds, a lot of them. Then you also have like the cardiac beds, people with the heart problems. So you'll find like the head is raised like this one. Well, you seem so interested in this.
I was in class myself. I'm learning. Well.
Great. Happy to have you. Maybe next time I'll have you now demonstrating what you have done.
I sure will.
Yes. But now, our learners, in our next class, we'll have this practical demonstrated by you in a well-structured way. So we'll have to dismantle everything. You begin with making all the beds, and then as we come to the next course, we'll be able to speak about all these issues that I was mentioning. Thank you. We meet some other time.